These days, whenever we are in doubt, it is very easy to get information because information is available everywhere. But when we have so much of information available with us, we get confused because same information is stated correct at some places and given as wrong at others. Then we wish we could have an expert advice. So friends, in this video we will take an expert advice from psychiatrist Dr. Rajiv Sharma regarding OCD and about its treatment. Cleanliness and clean house is liked by everyone, but there are few people who continuously keep on cleaning the cleaned house. Despite of the fact their hands are absolutely clean, they'll keep on washing their hands and at one go they reduce the size of the soap to half. In a day, many times the bed sheet and pillow cover has been changed. Even if someone come and sit on the bed for some time, again they will change it. If guest visits their house, they'll continuously keep on thinking that when he will go, then again I will start cleaning my house. Due to this, many times arguments and fight take place at home. This could be the indication of the problem OCD or false notation. Let's take an expert advice from Dr. Rajiv Sharma about this behavior and OCD. OCD means Obsessive Compulsion Disorder. Disorder means a state of confusion which is disturbing daily basis of activities. As per research, 2 or 3 out of every 100 people are suffering from OCD, whether they decide to take treatment or not. Although OCD is not a life-threatening disease, but because of this lot of time is wasted. And it results in case of 50 to 70% of people depression. There is a dedicated video on depression, you can check the link. OCD have 2 parts, obsession and compulsion. Obsession means being obsessed by some behavior or thoughts, and compulsion means due to these thoughts and behavior forced to act upon them. In obsession, there are 4 major points. First, irrational thoughts means patient is aware of the fact that thoughts which are coming in his mind are not right, but still he is not able to stop himself thinking about them. In OCD washing, a patient knows that his hands are absolutely clean, but still in his mind he is continuously feeling that his hands are dirty. Number 2, repetition means repetitively same thoughts are coming again and again that hands are dirty, hands are dirty. Number 3, unable to resist means person knows that thoughts which are coming in his mind are irrational, but still he is unable to control them, stop them. This leads to number 4, that is lots and lots of distress and tension. If due to this obsessive behavior, if a person is wasting minimum of 1 hour every day, continuously for 2 weeks, which indicates that it's the time to visit a psychiatrist or a psychologist. Obsession means continuously getting of irrational thoughts and unable to stop them. And compulsion means forced to act upon these irrational thoughts. Some people when take bath, they continuously bathe for 2 or 3 hours, which sometimes even end up with empty of water tanks. Because of this behavior, they themselves and their family members get very distressed. Water issue even burns up the argument between neighbors. Some people, despite of wearing clean clothes, they feel that their clothes are dirty and they end up washing clean clothes. This was only about clothes. Some people are so obsessed that they don't even hesitate to wash their mobile phones or even switchboards. They cannot use the toilet seat until it is sanitized and cleaned before every use. Means that these people are always ready with their cleaning tools. Some people even get cuts in their hands. Dr. Rajiv Sharma shared that some patients in the clinic come and tell that they feel like all the dust and germs from surroundings will come and enter their mouth. One of the patients used to feel that if she opens her mouth, a housefly or a mosquito will enter her mouth. So she used to keep her mouth shut and she used to brush her teeth 15 to 20 minutes continuously for many times in a day. Some people, if they see some pet animals with some infection or disease, they feel that only by seeing them they will get infected. If someone is cleaning or dusting, They feel that all the smell and germs will go in their mouth, so they keep their mouth shut. OCD leads to wastage of lots and lots of time. There is a very famous saying in Hindi that वहम का इलाज तो हकीम के पास भी नहीं है. Friends may not be Hakim, but definitely a psychiatrist and a psychologist have a cure for OCD. A psychologist will help the patient by counseling, but in case a medicine is needed, you need to go to a psychiatrist. Psychiatrist will give you a medicine, and within 2 to 3 months, medicine will start showing its positive results, which has to be taken continuously for 1 year, and in some cases maybe longer. A psychiatrist or a psychologist can help a patient to live a very happy and normal life. This was about OCD cleaning or washing. There are various different other type of OCDs also. We will talk in another video. Dr. Rajiv and I, Monica, in Beautiful Mind Academy have a mission to share the right information which could help million and million of people. And if you wish to be part of our mission by helping people, please like and share this video on different social media so that this can reach to more and more number of people who need to be aware of this important information. Please share and comment your views how can just by spreading the right information one can help many other people. Press the bell icon to get immediate notification about a new video. We'll keep on making such informative videos. If you don't want to miss, please click the subscribe button.